Thank you for joining our online event, Prevention of Domestic Violence Affecting Children During COVID-19. My name is Helen Veitch and I'm a Senior Programme Advisor at Family for Every Child. Family for Every Child is an alliance of currently 40 civil society organisations in 36 countries. We have goals around preventing family separation, strengthening families, ensuring high quality alternative care when needed, and protecting children outside of any care. Our members have a rich and unique understanding of the situation for children and families in local contexts, as well as potential solutions and effective interventions for improving children's care. As a global alliance, we work to ensure that more children can grow up safe and protected in families and be provided with quality alternative care when needed. Some of you will have hopefully engaged in one of our recent campaigns, through which we have created momentum and focus around key themes. These topics have been United for Boys, Children on the Move, and Kinship Care. And the subject of our event today is prevention of domestic violence affecting children during COVID-19. Governments around the world responded to the spread of COVID-19 by imposing lockdowns, quarantines, and school closures. While these measures have contained the spread of the virus, they have also increased the risk factors for intimate partner violence and child abuse, leading to what the UN has described as the shadow pandemic of domestic violence. Family for Every Child Alliance members have reported that domestic violence has increasingly become an issue to which they have had to respond. Our members have been in close contact with children, families, and communities during the pandemic, and they've seen that domestic violence is being inflicted on children either directly in the form of child abuse or through children being affected by the increased intimate partner violence within families. This is an issue of focus for us here at Family for Every Child and is the topic of our latest How We Care series. You can follow the link on the slide to view the whole series. In today's event, we will hear from 3 of our members who've been working on the ground on this issue. ChildLinK in Guyana, the Foundation for Innovative Social Development, or FISD in Sri Lanka, and the Association for Community Development, or ACD, in Bangladesh. And I would like to say a big thank you to Oak Foundation and the Tides Foundation for supporting our work on the prevention of domestic violence affecting children. We are currently working on a practitioner's toolkit for preventing domestic violence affecting children in COVID-19. And I just want to share a slide about that. This toolkit is being informed by local practitioners from around the world, including Families Alliance members. It will contain a variety of practices which have been tried and tested by practitioners working on the ground and are found to be suitable for use during the pandemic in light of the government restrictions and so on. Our goal for the toolkit is to make innovative and adaptable practices that can help prevent violence against children during the pandemic available to others. This should be available to share widely later this year, and we will keep you posted on that. So now I'd like to introduce our panelists. Dr. Champa Gunasekera is the chairperson and general secretary of the Foundation for Innovative Social Development in Sri Lanka. She's a lawyer by profession with over 30 years of experience in legal practice, as well as working on children's rights. Champa is also chair of the National Action Coordination Group in Sri Lanka, the network of civil society organisations set up under the South Asia Initiative to End Violence Against Children. In this role, Champa has led and guided the group of civil society actors through a consultation with children during the COVID-19 pandemic to understand the perspectives of children on child protection during the pandemic and the gaps in service delivery. Next, we have Samitha Sugathimala, who is Director of Programs at Foundation for Innovative Social Development. She works as a consultant on sexual and gender-based violence and gender-related development issues. Samitha is also the country coordinator of the Men Engage Alliance in Sri Lanka and the regional coordinator for Men Engage South Asia. She has over 17 years work experience in the field of gender justice as a program designer, a trainer, and an advocator, and has extensive practice knowledge on community-based approaches for the prevention of sexual and gender-based violence and working with men and masculinities. We have Sharmin Subrina. Subrina has been working with the Association for Community Development, ACD, in Bangladesh since 2005 and is a member of the senior management team. She leads the youth and children portfolio using a rights-based approach. Through innovative practices, she empowers the most women, adolescents, and children. Subrina has been an active campaigner around the sexual exploitation of children. She has taken part in a variety of national and international policy debates around these issues. And finally, we have Ashome Clarke, who's a social worker with a bachelor's degree in social work from the University of Guyana and has an advanced diploma in project management from the Institute of Commercial Management in the UK. Ashome is the program manager at ChildLinK. She's a role model for women and girls and an advocate for children's rights. Ashome has 10 years of experience working with youth, children, women and families who are at risk of abuse across Guyana. So turning first to you, Champa and Samitha, I'd like to invite you to give us an overview of domestic violence during the pandemic from the Sri Lankan context, please, and your approaches to supporting children and families.
Thank you, Helen. I'll be starting from Sri Lanka. If you go to the next slide, please. Thank you. So it's good afternoon from Sri Lanka and greetings to all of you all around the world. I think just to explain the situation of domestic violence from the Sri Lankan context, it had been quite a sensitive subject in our societies because it had always been considered a private matter and people would not therefore report. And they think family is a very private space. Of course, we do understand the reasons, but when it comes to domestic violence, it had affected a lot that thinking behind it and also the cultural practices or cultural understanding of how domestic violence is being understanding as a private matter, how it had been really challenging when it comes to interventions and finding solutions. So just to give an overview, there is no national data on domestic violence. The available data is also very scattered, either geographically or within categories of families where you have the data on the situation of domestic violence related to estate women or to pregnant women, or particularly in low-income families and etc. So it is. But the situation is not really good since it is indicated that over the years that there had been around 60% or even more of women experiencing domestic violence in their families. To make it worse, over the past, I think, maybe 18 months where we have experienced the COVID situation in Sri Lanka, we have noticed, and it had been reported, and we are sure that there had been a lot of unreported cases as well. The situation of domestic violence has increased, And although not constant, there had been an increase of approximately 20% in the reported cases. So that is where our context of the interventions comes from, which I will invite Champa to explain to you further. Thank you.
Violence against children is actually another phase of domestic violence. Punishment as a measure of discipline is acceptable in the society. Therefore, humiliating and degradable physical punishment, verbal abuse beyond tolerance levels are prevalent in Sri Lanka. We also find cruelty to children. So during the COVID situation, the usual pattern of life was completely changed, and a set of new norms, rules, and practices started to dictate people's lives. Prediction was that a new set of risks and challenges for children and women would be possible. So we saw at that time that the government's priority was health, and it was only health. As a result, we saw that the protection and well-being of children and women were rather neglected. National Child Protection Authority reported 40% increase in child cruelty reported to them during the first 2 months of the pandemic. It was evident that lockdown had exposed children to a multitude of risks, and FISD was very eager to work towards the protection of children. Next slide, please. FISDs were mainly working on 2 geographic settings. One is village settings, and the other is tea estates, where the culture, work modality, environment are entirely different to one another. I'm just showing you a picture of the estate setting. You would see that each color, there are several colors along the line of houses. Each color denotes the boundary of each house. These line houses are about 150 square feet, which includes the cooking area as well. So about 18 houses are in one line row, back to back, and divided one another from a common wall. You can see that there is no garden space in between the 2 house rows. So children usually were outdoors, roaming about, gathering wherever they found space. We had to keep them indoors to prevent imminent threat of getting infected. Fortunately, during the first wave of COVID, estate sector was secured for one thing because of its geographic setting, which is shutting them away from the other villages. The other reason was mobility was barred inter-district, and there were no outsiders coming into the estate. But the village setting was entirely different. However, in both the settings, since parents were not used to having children at home the entire day, and they were also home, both children and parents were becoming stressful and further not understanding how to cope with their stress levels. So therefore, children were becoming more vulnerable to violence. Next slide, please. Our ongoing programs had almost come to a standstill. So thinking out of the box, we looked at what and how we could engage the families to protect children and women from probable violence. Through our experience, it was obvious that we needed to strengthen family relationships. We had 2 initiatives in mind. One for the estate sector, mainly for taking into consideration the environment. The other for village. And we knew specifically that traditional approaches were not possible for us. Both initiatives are based on strengthening family relationship building, getting the entire family engaged in common activities. The initiative introduced to the estate sector looked at promoting children's positive experiences through creative arts. Village setting will be explained by Samitha later. Next slide, please. A survey was carried out at the outset of the initiative to find number of families that would fit into our criteria. During that survey, we also found that there were hardly any activities that parents and children did together. We actually worked with 355 families involving children between the age of 5 to 18 years. A 6-month program was designed, giving families ample time to work together. Next slide, please. We had actually distributed some recreational packs, and we got the families to play together, do artwork together, and see how best they could, spend more time together as a family. At the end of 5 months, families were supposed to translate to artwork their happy moments experienced during the previous months. Inspired by the new enjoyable family time spent together, they even went on to create creative work like crafts they were doing together. Next slide, please. During the awareness sessions that we had on the initiative and also during progress assessments, we made use of the opportunity to talk about safety measures on COVID, risks and dangers children would face during this period, and also on child sexual abuse. This was kind of a grabbing the opportunity. Next slide, please. We also got the children to make risk maps because children had no idea as to what imminent dangers they had. And we got them to do campaigns for safety measures on COVID-19. And also list out activities that they could do together with parents as an approach of self-learning. At the moment, these estates have recorded a very minimal number of COVID-19 cases because they got knowledgeable during the campaign. Next slide, please. So finally, we were able to get them to select 2 of their artwork that they wanted to preserve and scanned, laminated, and bound together with their certificates. Children were very happy to see that they got this into their hands. More than the artwork, they said, we want the certificates in our hands. So we are happy that we were able to give them something that they really wanted. Next slide, please. A customized logbook was presented to children, which was not actually planned at the beginning. This book contained activities that were suggesting for their different development areas, plus for self-protection. It also provides them ample space as a diary, in which they could make their entries, their progress in the activities that they are doing for selected developmental areas. We also thought that this logbook will be a continuity for them to develop their developmental areas and do activities as they want. So this is the intervention that we had for the estate sector, and Samitha will continue with the village setting. Thank you. Next slide, please.
Thank you, Helen, and thank you, Champa. So in the village setting, since it's more, people were more connected and that they had a more of a community base, we were able to kind of, practice a model which we called a happy families model. A family-based approach involving all the family members and having activities with them where we can kind of, get them to challenge each other in terms of how they want to do things at home, how they want to communicate at home, and also in a positive way. So that we can get so positive outcomes in terms of reducing domestic violence in the families. So Happy Families model is a relationship building program, of course, based on how the power factor is reflected in these relationships, depending on who controls, who take decisions, and who is the kind of, in our setting, we would say the patriarch in the family and who holds the power. So based on that, the relationships, have been quite affecting in these families, where when one actually controls the other members and decides how things would happen and how that person wants to kind of, manage the relationships. So the Happy Families model allowed us to address this power relationship in a very involving manner, in a very kind of kind of happy environment where each family member has a role to play. So especially in terms of getting involved the male members in the family. When it comes to domestic violence or any other kinds of interventions related to violence against women or children, it's always, like it becomes a matter for women. And men also thinks that it's a program for women and that they do not need to participate. Or that if a community sees men as perpetrators, that also really affects the engagement of men into these programs, because they try to stay away from all these activities. And when they see that women and children participate, and when they come home and start negotiating with men in the family in a different manner, they get annoyed. So we thought we don't want to separate men and women in these kinds of programs. That is why we wanted to have a family-based approach where especially men also feel connected, so that they feel that it's a space that they can also express their emotions, and that they can share how they feel. They can see what challenges they feel when it comes to relationship, and how they also get challenged by their own peers. So we had a lot of programs for women, for men, and families together, and also bringing children into some of these programs where children can also make an impact in the relationship of their parents. So we actually created that space for self-reflection, and also kind of how the family can develop within the given masculine and feminine frameworks in these communities. This actually allowed men and women to come out of their private and public spaces to seek support and belong to a group and feel comfortable doing it, not challenged by it. So that actually, that engagement, participation becomes a win-win situation for both men and women, and also for the families, and interaction between the families as well. How each family can become a role model for the other family. So this actually creates space for the families to celebrate positive changes in the family and appreciate their individual contributions as well. So that is how this Happy Families model had been created specifically to engage and connect male members in the family. Thank you. Champa? Yeah. Thank you, Helen. And in the village setting, since we had a lot of space and the families also had the home gardening, we thought the best way, especially during the COVID situation, say all family members were at home. And we thought, since they are at home, we need to get have some activity where all the family members can get involved, including men. That is why in the Happy Families model, we introduced the home gardening to engage the whole family. And it was quite timely since the whole country was, there was a country level program going on where a lot of promoting advertisement, promoting programs had been even going in the media to promote home gardening while you are at home. So we took that opportunity, and we actually created the environment in which it kind of created this conducive environment for families to come together to share their work of caring. Normally men do not, men always complain that they do not have the time to engage in these activities, since they are always, as the breadwinner, they are always out of the family. And that when they come home, that they are too tired to do anything, or to support their family members. But this opportunity of having all members in the family helped also men to understand that while if they start sharing activities with the family members, including that of children, that they can also benefit out of that. They can also strengthen their relationship with their children. And if they start appreciating each other, in the family, and also spend some quality time together, have some strong dialogues of the day-to-day activities or their own issues, their emotions, their feelings, that it would bind the family together. And also, it's really important, if you want to change something, if you want to kind of, have a different situation than what they are already having, we have already understood that the families need to have new form of habit formations. So that, certain things, they would do with the understanding that they want to change, or with the understanding that they would want to change in the future. But certain things people would do as they do normally, as their routine work or as habits. So we thought that we need to experiment all these things, and certain things which we kind of introduced has habits for the family, actually we were able to sustain. So that is how our home gardening project with the families during COVID actually worked really well. Champa?
I think we are running out of time, and these are only testimonies. Through the slides, I will just say that we have had actually testimonies of people to the effect that there have been changes in the behaviors. Children have said they are very happy. Men have said that they are very happy and they are getting involved in family houseworks. And males have very, especially in the estate sector, have said that they don't feel like going to drink alcohol. So all in all, we have observed behavioral changes in people in these two exercises. So thank you very much. I will stop our presentation from here. Thank you. We can have questions later if you have any queries. Yes, thank you very much.
Thank you, Champa and Samitha, for explaining your really fascinating work in Sri Lanka. I think you really showed how you had grabbed the opportunities that the COVID pandemic presented. And we're now going to hear from Subrina about ACD's approach in Bangladesh, which also focuses on some positive aspects and looking at positive discipline.
Thank you, Helen, and everyone. Good evening. Association for Community Development, ACD's goal is to ensure the rights of people, especially the disadvantaged and vulnerable women, adolescents, and children at grassroots level through improving their socio-economic, political, cultural status, ensuring social justice and good governance. I would request Helen to proceed into the next slide, please. We work through three sectoral approaches and sustainable development since 1989 in the northern part of Bangladesh. Our field programs cover to build and strengthen child protection system, focusing on prevention approach, respond to cases of child rights violations, especially sexual abuse. I already covered the thematic areas, so you can move on the context of domestic violence affecting children during COVID-19 pandemic. The marginalized and excluded people suffer the most human rights violations, such as violence, abuse, disrespect, and lack of access to justice. This happens mostly due to negative attitude of society towards them, negligence of service providers, inaccessibility to basic entitled services, inadequate pro-people policies and programs. During the COVID-19 pandemic, men and women have lost their livelihoods. Schools have been closed more than a year, and there has been an increase in child labor, exploitation, child marriage, and children begging on the streets. The country has patriarchal culture with gender discrimination rooted deeply in the socio-cultural environment. The tendency of parents to give more preference to boys and to see girls as a burden. Physical punishment of children is common, and parents often lack understanding of child rights. Next, please. Since the onset of the COVID-19 in March 2020, FISD initiated community-based interventions to prevent and respond to domestic violence affecting children. We have strengthened men's group, women group, adolescent groups, child rights forums, and engaged community and religious leaders across our programs, as well as elected members of local government to educate and support parents, empower women, and protect children. Next, please. So while we worked with various types of groups, and we found that during the COVID time, PDP, that is positive discipline in everyday parenting, it is an effective approach which we can address to protect and ensure the rights of children in Bangladesh. Many of the children became victims of violence in the home or family setting during the pandemic time, and still these incidents are increasing day by day. So we address the approach to parenting that teaches children and guides their behavior while respecting their rights to healthy development, protection from violence, and participation in their learning. Positive discipline is not permissive parenting. It's not about punishment. We can say that it helps to develop long-term solutions and develop children's discipline and lifelong skills. It has grounded 4 components, and it follows the child rights principles. So we can say that identify long-term child rearing goals, provide warmth and structure, understand how children think and how the children feel, and it also addresses problem solving. One of the causes of violence against children is lack of awareness and sensitization of parents and caregivers. During the lockdown in Bangladesh, the parents, especially the fathers, lost their income or had no job or opportunities in the local area. They remained at home and faced severe financial crises to maintain the day-to-day expenses. Not only the children, women of the family members are being tortured physically and mentally by the men. PDP approach can change parents' attitudes towards physical punishment and guide children's behavior in positive ways. We found they often punished or tortured children by beating or scolding and never thought children have self-respect. When the parents attempt to hurt children physically or verbally, they recall the learning of PDP training provided by ACD. So what we do at the community level, we form and organize parents group. In some parents groups are mixed group that children of both parents, that is father and mother, is present in one group, and we also form separate groups, like we work with mothers only and also separately with fathers. So when we train up on the issue, that is PDP issue, all the components, they have a feeling that how they should behave with their children. Fathers have a realization that they also have a significant role for well-being of a child. Parents reflect on children's interest and respond accordingly after getting the training or session from ACD. Next, please. Positive discipline makes parents realize how children think and feel at different ages. So we not only work with the parents, but we give emphasis on social mobilization, organizing of training and awareness, share learning with related stakeholders, intergenerational meetings, ensure men and women and children's participation in our program, document the best practices or learning, and present at different government forums, which ultimately contribute in behavior change and protect children from being victimization during the pandemic time. So we can think, or it's our field observation while we work with the children and parents in the community level. Positive discipline is based on two fundamental pillars: the elimination of physical and emotional punishment of children and the promotion of UNCRC. Enabling environment need to be created by the duty bearers where children will have the right to participate and express. Next, please. The PDP program, that is Positive Discipline in Everyday Parenting, addresses educating parents on child rights, child development, also stress management, and many more. Positive discipline raises parental awareness, helps to determine and achieving the long-term goals of a child. This approach can build good relation between children and parents or caregivers to reduce physical and humiliating punishment towards their child. The techniques help parents understand the treatment of their children as well as themselves and find the appropriate solutions in various situations, even during the disaster period or pandemic situation. So lastly, what I can say that when we approach this PDP, that is Positive Discipline in Everyday Parenting, we also applied this approach before the COVID, and we see that, or it is our observation that during the COVID, the violence against children, it's increasing day by day, and it's happening at the family level. So if needed, we need to work more closely with the parents and other stakeholders. So my last slide indicates that we want to be free from all sorts of violence, and we need to work together to advance the right to protection, education, and development. Thank you.
Thank you very much, Subrina. It was really interesting perspective, and I think you outlined essentially what a program that you were already implementing, and when the COVID came along and there was a big increase in domestic violence, you adapted it to that process, which is really interesting to hear about. We're now going to move to South America, to Guyana, and hear from Ashome, who will be explaining how ChildLinK adapted their program in order to address domestic violence.
Thank you, Helen. Good morning, everyone from Guyana. Next slide. ChildLinK is a non-governmental organization. Our work focuses mainly on protecting children against abuse, exploitation, and violence. We believe that every child should grow up in a safe environment. Our view on domestic violence, that violence within the family, and it speaks to women, girls, men, and boys, is a profound violation of human rights, and is also considered as a security and a public health issue. Next slide. Domestic violence in Guyana inflicted upon children. Children are witnesses to the abusive behavior or are themselves victims of it. It damaged the prospect of our economic and our social development of our country in Guyana. It's being perpetuated against men, but women are overwhelmingly the victim. ChildLinK work focuses largely on prevention of sexual violence and extend to equip families to prevent violence. So during the pandemic in Guyana, the support that the government offered nationally during the pandemic, the Ministry of Human Service, Social Protection, they partner with UNICEF and several other telecommunication entities and launch a 914 toll-free hotline for persons experiencing domestic violence. So the 914 toll-free hotline, it answers, and behind that answer, there's a tangible help that can change someone's life. Once that person calls in, the necessary is done, either at the police station or the hospital, and the person will be linked to a survival advocacy program. The ministry launched their advocacy program, survival program was launched last year during the pandemic. It's a pilot project in 3 regions, region 4, 5, region 4, 2, and 6. So Guyana has 10 administrative regions. These areas have the highest number of reported cases of violence against women and girls. The DV Survival Advocate Program focuses mostly on emotional support, crisis counseling to victims, DV, and sexual violence. Support persons in coping with the challenges faced. Now, the NGOs and the civil society organization provide services such as counseling and safe space with a focus from ChildLinK on child sexual abuse. Next slide. ChildLinK offers support to families experiencing domestic violence. We at ChildLinK, we provide psychosocial support to children and family via online, telephone, Zoom, limited face-to-face counseling. We refer families to agencies that provide safe space for accommodation, conduct parental education support to parents who are victims of domestic violence, and provide court supports to family. So these are the services that ChildLinK offered during the pandemic and is still offering. Next slide. So at ChildLinK, we created the Building Family Bond workbook during the COVID-19 pandemic. This workbook was created to help adults to improve their parental skills, their emotional support, and the care for vulnerable children, many of whom have experienced abuse. The workbook basically created specifically for support the children and the family all across Guyana. During COVID-19, the team of social workers and counselors at ChildLinK observed many difficulty children are experiencing in their families and communities, some of which all forms of abuse, lack of supervision, loss of parents, and many other challenges. It was very difficult for children and their families to continue accessing the face-to-face counseling services. Children who are or who were traumatized by high level of violence. And what we found out is that families have little access to telephones and internet. So this workbook basically developed or created to engage children and parents, caregivers, in an effort to strengthen family bond and safety. The workbook includes 5 modules aimed at stopping abuse and strengthening bonds between children, their parents. Stress management technique, that's one of the modules. Strengthening coping mechanisms, second module, and the importance of family-based care. The fourth, child abuse prevention strategies. And the fifth module speaks to activities for improving family communication. We at ChildLinK believe that through the Building Family Bond workbook, we aim that homes can become a helping and a sheltering environment that children need. This workbook, the sessions are delivered using a child creative approach, communicating with love, compassion, and gentle guidance. The activities in the workbook are designed around listening, sharing, and caring for the family. Our learnings during the pandemic and as we go along, we found out and observed that families are affected by domestic violence, especially children who are witnesses to it. We also learned that families who experience DV, that's women and girls, need strong family support. DV has no face, color, race, or ethnicity in our learnings. We also learned that men and boys are silent in reporting DV. And this has to do with many factors, our men and boys socialization, the culture, the discrimination. We also learned that there's an increase in reporting of child sexual abuse and DV during the COVID-19 pandemic because of the lockdown, because of the restriction. And as a result of the increase, because a system was being put in place, the 911 toll-free hotline was put in place, so many persons are reporting domestic violence. There's an improved network system with the key stakeholders, such as police, government ministries, NGOs, and civil society. We learned that the networking system is working currently. Persons can call. So when you call the 914 toll-free, you can get the police, you can get the health sector, you can even connect an NGOs for providing support. So these are our learnings. Thank you. Next slide. This is an activity that was done with an at-risk family in a community during the COVID-19. The families was brought together in terms of behavioral issues and to empower parents to better cope during the pandemic, especially in providing care and support for their children. These families are vulnerable families. They were relocated to a new environment where they are currently safe and comfortable, but continued work is being done with this family. So you can see at the back, there's the children at the back and the parents together. Thank you very much.
Thank you, Ashome. I think your presentation for me raised some interesting questions about the silence from men and boys around domestic violence. But I'd like to thank you all for raising questions and issues that are definitely worth thinking about in more detail. There's been some fascinating insight into your work, both on the prevention and also the response to domestic violence affecting children. And very interesting to look at the different contexts during the COVID-19 pandemic. We're now going to open up the floor to questions from the audience. And I can see that somebody has already asked a question in the Q&A box. So I will read it out. It's to Champa, I think, and Samitha maybe. So they're saying, we really appreciate the model because staff need to facilitate the activities amidst COVID-19. What are the challenges, especially during lockdown, travel restriction and government restricted gathering? And so I guess that can go to Champa and Samitha to begin with, but then I think everybody else can answer that question too.
Thank you, Helen. And thank you for that question. That's a very relevant question because that had been the main challenge that we actually faced during the pandemic. But of course, in two different settings that we explained, in the estate sector, we already had volunteers working with us from the community itself, from the estate itself, youth volunteers. So what we did was we mobilized the youth volunteers through different, different online platforms. We formed a WhatsApp group. We actually had Zoom meetings with them, and also teleconferencing. So all these three methods we used to connect with them and to mobilize them around their own communities so that they can get engaged with the children in the families, to get them motivated to do the drawings, and also motivate the family members to engage in the drawing activities and other games that we introduce to them. So most of the the communication did happen through these models, and it had been quite even further challenging because we initially had 3 months of total country level lockdown, but then little by little we had openings here and there, we had few villages isolated, but the others were open. So we managed to, when it allowed us to reach to the communities, we always use those opportunities to get connected. And in the village setting, of course, people did not have much access to digital devices. Even in the estate sector, few of the volunteers only had, but they ultimately within the estate itself, they could come together, unlike in the village setting. They were even not able to move around within their own villages, isolated very much in their own houses. So, and they also didn't have much access to devices. So we had to totally depend on teleconferencing. It had been quite expensive method, but yet with the kind of allowances from the donors, acceptance from the donors to use that kind of method, we were able to use it and had more of regular communication with them. And also to add on to that, since this home gardening kind of approach was a country level engagement in a way, because government promoted that, they had their own home gardening programs going on in many of the other villages all over the country. So our staff in the district had bit of allowances, when we partnered with the government at the local level, with the local government agencies, local government institutions. They actually had a bit of allowances to distribute the seeds and to kind of have bit of distant, although to reach the community and maybe not gather people, but have distant communication on how they could mobilize around the home gardening. And then when the country opened around June, mid-year last year, we were able to catch up from there. Our staff was able to visit once in a while and then gather a small number of people and to mobilize women collectives where they can get their peer groups engaged, and did same with men, where we work with men who were quite engaged and allowed them to do their peer activities within their own circles. So we actually used all the methods that we could use and utilize all online, offline approaches that we could benefit from. So that's how we actually managed. Thank you.
Thank you. That's very interesting. It's interesting to hear that there's government support as well. Was that the case in any of the other countries? Ashome, would you like to explain how it worked in Guyana?
Yes, in Guyana, because of the restrictions and the limit face-to-face contact, we at ChildLinK in Guyana, we created WhatsApp group. We work with the children and the family via WhatsApp. on telephone. We try our best to have a face-to-face, one or two, if there's an emergency. So once there's an emergency and the child has to be removed, then you go, but you take all the prevention measures, like you wear your face mask, your hand sanitize, because that physical contact is very important. But most of our sessions and activities was done via WhatsApp, Zoom, and telephone in Guyana. And that's why we, in Guyana, the 914 toll-hot free line was launched so that persons can call in and report. So when you report, there's different channels will be connected to the police, the hospital, and you'll be provided with a social worker who will conduct an interview and the whole process in terms of you getting that support that you need in Guyana.
Great, thank you very much. It's really interesting to hear how governments have kind of stepped up a bit, because maybe because it's happening across the world and every government is facing this situation. Subrina, would you like to explain how you got over the government restrictions and if there was any support?
Thank you, Helen. So while during the pandemic time, and in Bangladesh still the lockdown is going on. So what we did in last year and also in this year, we worked through our community volunteers and the group leaders. As I have mentioned in my presentation, that in the community level, we have formed and strengthened various types of groups like men's group, women's group, children's groups. So in every group, there is a group leader. So we had or we still keep connection with the group leaders so that they can disseminate the information to the children or the group leaders about the pandemic situation, how they can be protected from violence, how they will report sexual violence incidents, how they will apply the hotline numbers, and in some areas the government is also providing relief services. So our group members tried to enlist the group members to avail the government services. In this way, we worked through the community-led leaders side by side, our frontline workers. We did one-to-one session through telephone, and when the lockdown was not much strict and there were some circular from the government that we can move in the community level and organize the events in a smaller group. So in that case, we were able to do some face-to-face or physical events, but not for a longer period of time. But we had to report to government time to time, actually what we, the NGOs or civil societies, are doing to protect the rights of the children of our country. Thank you.
Thanks, Subrina. It's all very interesting, and I think what it does show that those CSOs and NGOs that were doing community-based work, you could use your community links as communication channel where the INGOs and governments just didn't have that link. It's very interesting. We have another question in the Q&A box from Deepti, and it says, thank you all panelists for very interesting presentations. And her question is about how violence against boys, especially sexual violence, was addressed in your interventions. And I'll just leave that open to whoever wants to answer.
I will start from FISD. Actually, during our interventions, I said that we grabbed the opportunity to aware the community on the probable dangers that children could face. So in this, we have covered actually what kind of sexual violence or exploitation that could happen to boys. In Sri Lanka, this is not a topic that's discussed in the general arena. it is attention is on the girls' sexual violence. So as FISD, we actually wanted to highlight that boys also do get sexually abused, and they are prone to violence. So our awareness programs have captured that aspect as well. And I mentioned that we have given a logbook to them, where we have looked at what kind of protection measures that whether they are boys or girls could take at a time of violence. How they could protect themselves, how they could, talk to a trusted person, things like that. And who is a trusted person? Within our program, we try to, bring in different elements and protect both boys as well as girls. Thank you.
Thank you. Was there anyone else who had a comment on boys, and particularly sexual violence of boys?
Yes, boys are treated with the same care and love.
Thank you.
Boys are treated with the same care and love as girls. ChildLinK has a few child advocacy centers that works with sexual violence children who were sexually abused, and boys can walk into the center. They can be referred to the center either by the National Child Protection Agency, the police, and they will receive the same services as the girls receive. There's the center, that's where they will tell the story. There will be a police officer, a social worker, a forensic view officer, and the boy can tell his story or the child can tell his story. And that is where you tell your story and you're being listened to, and that information is the information that the police officer will follow up, and the information will be at court. So boys have that space where they can come in and they can report or they can call, and they will be supported, just like how the girls are being supported when it comes to sexual abuse or sexual violence.
Thanks very much, Ashome. I'm conscious of the time and that there is another question. So I'll move straight on to that. And it comes from Indonesia. Somebody who is asking about the parenting programs that were run, I think by, it's relevant to all four speakers. And they are saying that in Sumba, in Indonesia, they are running a program called Real Fathers, which has been suspended or delayed due to government restrictions. And they're currently seeking ideas to adapt the program. So they're interested in knowing how you overcame the restrictions of face-to-face meetings for rural village communities, because they don't have such strong, have no internet connectivity and limited access to mobile phones. So if anyone can speak about that issue, I'd be very grateful if you could just take over the mic. And thank you for the question. Terima kasih. I can say a little bit of Indonesian and get that in there.
Yeah, thank you. I think I can address a few points. That is during actually we do the PDP sessions, that is 8 sessions for each of the groups through face-to-face. And during the pandemic time, what we did, I already mentioned that how we keep contacted with our group members through our community volunteers. So during the lockdown, as we work in the rural areas, and that could be indigenous community or very marginalized community. So we keep contact with the local elected bodies and local community leaders. So that they are aware of our program and the necessity of PDP during the pandemic sessions. In one way, they provide support to us, and side by side, we train up our community volunteers and the group leaders to hold a meeting in the community level. In some cases, what we did, that we did very small group meetings, like 2 or 3 person in a group, and we provided delivered the session to phone, that is cell phone. That is, for example, I'm delivering the session through my mobile phone, and the community leader, he or she also has the mobile phones, and we open up the speaker and they are able to hear our lectures. In this way, we have done it during the pandemic time, and in some cases, in order to do the follow-up, whether the sessions are helpful for them, we individually talked with the group members to know how they are applying the PDP learning in their in the family level, and how they are caring their children, how they are protecting them from other forms of violence and others. Thank you.
So does anyone else have any examples of
Yes.
way programs can be adapted? Thank you, Ashome.
Yes, Ellen. So ChildLinK has collaborated with several community-based organizations in the different regions, and they are trained to work with grassroots families in the community. So ChildLinK would share the work that we're currently doing with our partners, so that our partners can engage those families, those vulnerable families in the community. And we use the same WhatsApp, the Zoom. There's small grouping, like 4 or 3 persons, especially parents who need that physical contact, the physical contact to express or to feel safe to share their story. So a lot of our work is being shared with our grassroots partners to work with domestic violent family and families who are faced with all forms of abuse in those areas. So our parental officer, she will work closely with the grassroots partners and the family with a small grouping. And we use all of our parental material that focus on building family bond, focus on safety, focus on empowering women and girls and men, and how to cope during the pandemic. So we have that module that we can use.
So Helen, if I may come in also, just to explain how we actually used this method of developing few animations. We knew that only, like, you know, maybe less than 10% people do have smartphones at village or state level. But with the volunteers and village level community leaders that we have been working with, we wanted to give them materials which are so expressive and that they can easily use, they can easily get the attention of members in the community. So we actually had developed you know, very short video clips, and also the Menengage Alliance in Sri Lanka developed a few animation. I actually shared that link to the YouTube channel, YouTube videos of Equal Partners, if anybody is interested, along with you know, the Ministry of Women Affairs and UNDP. Menengage Alliance developed these animation videos to communicate with the families through the people who had small smartphones, to share these animations, which are very expressive. And even, you know, if you, it's really easy for the person to explain the whole story to other person, you know, share it among their peer groups, and so that they don't want to have their own interpretations of how things needs to happen, but they can learn from the animations and then explain to another person. So, I mean, among many things that we did, I just wanted to share this because that had been a quite interesting way of communicating and kind of, you know, mobilizing around building relationships and changing gender norms in the families.
Thanks, Subrina. It's really interesting to hear all the different options, although they do seem, it does feel as though the fact that all your organizations have very deep roots into the community, that seems to be the answer, doesn't it? That you use those, and it's about building relationships and using those relationships, strengthening them to create communication channels to areas where they don't have internet access, and you're able to use these kind of community leaders, I guess. I think there is one more question in the box. I'll just read it out. The necessity to provide face-to-face support to the community was made possible during COVID restrictions by another family for every child member, FISD, in Zimbabwe, as the organization was designated as an essential service provider. This allowed them to reach hard to reach rural areas. Thank you, Deepti. And I think also that what I've seen from the reading I've been doing about COVID is that the helplines also have been really crucial, and being designated as an essential service provider is something that now needs to kind of go forward, I guess, and means that governments need to invest in those essential providers. I think that was very clear from the pandemic, just how essential all your work is, and that nobody else is really in that position that you have with these trusted relationships with the communities to do this kind of work. So thank you very much for sharing your work. I think we're approaching the end of the online event. I'm just checking, there is one. Oh, Samitha has shared a link in the chat, in the question and answers box, if you want to follow that. But for now, I think we're coming to the end, and I wanted to just move on to the next slide and talk about. It's not letting me. Yes, it is. So before we close, I wanted to just share that Family for Every Child has recently launched a new community platform for child rights practitioners, and it's called Changemakers for Children. Many of you may have signed up for this event via the platform. It's a space for local practitioners to come together and connect, collaborate, and communicate, and to learn from each other about what's working on the ground, as we've been doing today, to participate in discussions, solve problems, participate in advocacy initiatives, and engage with and influence the wider sector. We welcome our wider sector colleagues to join us in this global digital platform, and we really look forward to welcoming you on Changemakers for Children. You can visit Changemakers for Children. I think it's changemakersforchildren.community to sign up, as is on the bottom of your screen. And we'll also post the URL on our chat box now. So in closing, I'd like to thank our speakers for taking the time to share their work and their insights, and to all of you for joining and participating. Before we end, we ask you to please complete a final poll to share some feedback with us on today's event. We hope to see you again soon for another online event. Thank you very, very much.